In humans, the kidneys are two reddish-brown bean-shaped blood-filtering organs that are a multilobar, multipapillary form of mammalian kidneys, usually without signs of external lobulation. They are located on the left and right in the retroperitoneal space, and in adult humans are about 12 centimeters, 4+1/2 inches, in length. They receive blood from the paired renal arteries. Blood exits into the paired renal veins. Each kidney is attached to a ureter, a tube that carries excreted urine to the bladder. The kidney participates in the control of the volume of various body fluids, fluid osmolality, acid-base balance, various electrolyte concentrations, and removal of toxins. Filtration occurs in the glomerulus. 1/5 of the blood volume that enters the kidneys is filtered. Examples of substances reabsorbed are solute-free water, sodium, bicarbonate, glucose, and amino acids. Examples of substances secreted are hydrogen, ammonium, potassium, and uric acid. The nephron is the structural and functional unit of the kidney. Each adult human kidney contains around 1 million nephrons, while a mouse kidney contains only about 12,500 nephrons. The kidneys also carry out functions independent of the nephrons. For example, they convert a precursor of vitamin D to its active form, calcitriol, and synthesize the hormones erythropoietin and renin. Chronic kidney disease, CKD, has been recognized as a leading public health problem worldwide. The global estimated prevalence of CKD is 13.4%, and patients with kidney failure needing renal replacement therapy are estimated between 5 and 7 million. Procedures used in the management of kidney disease include chemical and microscopic examination of the urine, urinalysis, measurement of kidney function by calculating the estimated glomerular filtration rate, eGFR, using the serum creatinine, and kidney biopsy and CT scan to evaluate for abnormal anatomy. Dialysis and kidney transplantation are used to treat kidney failure. One, or both sequentially, of these are almost always used when renal function drops below 15%. Nephrectomy is frequently used to cure renal cell carcinoma. Renal physiology is the study of kidney function. Nephrology is the medical specialty which addresses diseases of kidney function. These include CKD, nephritic and nephrotic syndromes, acute kidney injury, and pyelonephritis. Urology addresses diseases of kidney and urinary tract anatomy. These include cancer, renal cysts, kidney stones and ureteral stones, and urinary tract obstruction. The word renal is an adjective meaning relating to the kidneys, and its roots are French or late Latin. Whereas according to some opinions, renal should be replaced with kidney in scientific writings such as kidney artery, other experts have advocated preserving the use of renal as appropriate, including in renal artery. Structure. In humans, the kidneys are located high in the abdominal cavity, one on each side of the spine, and lie in a retroperitoneal position at a slightly oblique angle. The asymmetry within the abdominal cavity, caused by the position of the liver, typically results in the right kidney being slightly lower and smaller than the left, and being placed slightly more to the middle than the left kidney. The left kidney is approximately at the vertebral level T12 to L3, and the right is slightly lower. The right kidney sits just below the diaphragm and posterior to the liver. The left kidney sits below the diaphragm and posterior to the spleen. On top of each kidney is an adrenal gland. The upper parts of the kidneys are partially protected by the 11th and 12th ribs. Each kidney, with its adrenal gland, is surrounded by two layers of fat, the perirenal fat present between renal fascia and renal capsule and pararenal fat superior to the renal fascia. The human kidney is a bean-shaped structure with a convex and a concave border. A recessed area on the concave border is the renal hilum, where the renal artery enters the kidney and the renal vein and ureter leave. The kidney is surrounded by tough fibrous tissue, the renal capsule, which is itself surrounded by perirenal fat, renal fascia, and pararenal fat. The anterior, front, surface of these tissues is the peritoneum, while the posterior, rear, surface is the transversalis fascia. The superior pole of the right kidney is adjacent to the liver. For the left kidney, it is next to the spleen. Both, therefore, move down upon inhalation. A Danish study measured the median renal length to be 11.2 centimeters, 4+7/16 in, on the left side and 10.9 centimeters, 4+5/16 in, on the right side in adults. Median renal volumes were 146 cubic centimeters, 8+15/16 cu in, on the left and 134 cubic centimeters, 8+3/16 cu in, on the right. Anatomy. The functional substance, or parenchyma, of the human kidney is divided into two major structures, the outer renal cortex and the inner renal medulla. These structures take the shape of 8 to 18 cone-shaped renal lobes, each containing renal cortex surrounding a portion of medulla called a renal pyramid. 18. Between the renal pyramids are projections of cortex called renal columns. Nephrons, the urine-producing functional structures of the kidney, span the cortex and medulla. The initial filtering portion of a nephron is the renal corpuscle, which is located in the cortex. This is followed by a renal tubule that passes from the cortex deep into the medullary pyramids. Part of the renal cortex, a medullary ray, is a collection of renal tubules that drain into a single collecting duct. The tip, or papilla, of each pyramid empties urine into a minor calyx, minor calyces empty into major calyces, and major calyces empty into the renal pelvis. This becomes the ureter. At the hilum, the ureter and renal vein exit the kidney and the renal artery enters. Hilar fat and lymphatic tissue with lymph nodes surround these structures. The hilar fat is contiguous with a fat-filled cavity called the renal sinus. The renal sinus collectively contains the renal pelvis and calyces and separates these structures from the renal medullary tissue. Blood supply. The kidneys receive blood from the renal arteries, left and right, which branch directly from the abdominal aorta. The kidneys receive approximately 20 to 25% of cardiac output in adult human. Each renal artery branches into segmental arteries, dividing further into interlobar arteries, which penetrate the renal capsule and extend through the renal columns between the renal pyramids. The interlobar arteries then supply blood to the arcuate arteries that run through the boundary of the cortex and the medulla. Each arcuate artery supplies several interlobular arteries that feed into the afferent arterioles that supply the glomeruli. Blood drains from the kidneys, ultimately into the inferior vena cava. After filtration occurs, the blood moves through a small network of small veins, venules, that converge into interlobular veins. As with the arteriole distribution, the veins follow the same pattern. The interlobular provide blood to the arcuate veins, then back to the interlobar veins, which come to form the renal veins which exit the kidney. Nerve supply. The kidney and nervous system communicate via the renal plexus, whose fibers course along the renal arteries to reach each kidney. Input from the sympathetic nervous system triggers vasoconstriction in the kidney, thereby reducing renal blood flow. The kidney also receives input from the parasympathetic nervous system, by way of the renal branches of the vagus nerve. The function of this is yet unclear. Sensory input from the kidney travels to the T10-11 levels of the spinal cord and is sensed in the corresponding dermatome. Thus, pain in the flank region may be referred from corresponding kidney. Microanatomy. Renal histology is the study of the microscopic structure of the kidney. The adult human kidney contains at least 26 distinct cell types. Distinct cell types include kidney glomerulus parietal cell, kidney glomerulus podocyte, kidney proximal tubule brush border cell, loop of Henle thin segment cell, thick ascending limb cell, kidney distal tubule cell, collecting duct principal cell, collecting duct intercalated cell.